Mi nombre es Federico Telmo, soy el gerente comercial de Access Medical Systems, representante exclusivo en Argentina de United Imaging Healthcare. United Imaging es un fabricante chino de equipamiento de diagnóstico por imágenes, cuya visión es liderar la innovación en el sector. Para ello, la empresa ha fundado una subsidiaria dedicada exclusivamente a investigación en el área de inteligencia artificial. La misma está basada en Boston, Estados Unidos, y es liderada por su CEO, el doctor Terrence Chen, quien nos acompaña el día de hoy para exponer en qué están trabajando hoy en día y cómo piensan revolucionar el sector mediante inteligencia artificial. La charla va a ser en inglés, pero tendrán la oportunidad de ver la traducción simultánea. Tienen un código de QR que pueden utilizar para escuchar la traducción simultánea del Dr. Chen. La charla durará unos 40 minutos y luego habrá un espacio para preguntas y respuestas. Las mismas tendrán que ser realizadas a través del chat, pueden ser realizadas en español o en inglés, y nosotros en todo caso las traduciremos para que el Dr. Chen se pueda explayar. Así que sin más preámbulos, le paso el piso al Dr. Chen. Dr. Chen, you can start. Thank you very much for joining us, and the floor is all yours.
Thank you. Hola, hi everyone. My name is Terrence Chen, head of United Imaging Intelligence America. So in this talk, I will tell you about how United Imaging innovates and applies advanced AI technologies to empower our scanners and clinicians and provide better healthcare for all. So our company's headquarters is in Shanghai. Currently, we have 7 AI R&D sites globally, including one in Boston, United States. In the past 2 years, our AI technologies have won 3 international awards, including the winner of the Sector Challenge in ISB 2019, the winner of the Fast MRI Challenge in multi-coil 4 times category, and the Super AI Leader Awards in World AI Conference in 2020. The first award is about the accuracy of our AI segmentation algorithm. The second award is about the image quality of our AI image reconstruction algorithm. And the third award is about the real clinical impact of our AI solutions. We have deployed more than 20 AI applications in close to 500 clinical sites. So our AI solutions are used by doctors and technicians to improve their work every day. If we take a look at the clinical workflow of the medical imaging chain, we can start from the source of imaging, which is when and where the medical images are generated. Once the images are generated, they are processed and used in clinical for screening, follow-up, diagnosis, therapy, and all the way to disease prediction and assessment. AI can be used in every aspect of this chain and provides improvement for better clinical outcome. Based on this understanding, we deploy our AI technologies in 3 different major ways. First, we call it UAI Insight. It's to use AI to empower medical devices and make them smarter and generate better image quality with higher efficiency. Second, a web portal which provides various AI clinical applications to empower the physicians for better efficiency and accuracies in their work. Third, a research portal which provides modularized AI algorithms to facilitate advanced AI research by healthcare professionals. Now let's focus first on the AI which make our scanners smarter and more powerful. First, let's take a look at some AI technologies with our CT scanners. We use AI to empower our CT scanners, starting from the patient preparation all the way to post-processing. UI vision automates patient positioning and enables one-button scanning. AI automatically determines scan range and optimized image radiation dose. AI then helps to reconstruct the images, denoise the image, and correct motions such as head motions. After the images are obtained, AI reads the images and provides alert and indications of various lesions, such as rib fracture, lung nodules, and pneumonia for chest CT scan, and ICH for head CT scan. So UI vision uses AI and computer vision technologies to automatically position the patient given selected scan protocol. It then optimizes radiation dose by more precise scan range, as well as automatic ISO centering. Our deep learning-based reconstruction technologies, Delta, is able to output high-dose image given scan with low radiation dose. It was trained on a huge amount of data with various body parts to optimize image quality for different noise patterns. So with this technology, we can either reduce up to 85% of those given clinical comparable image quality, or can enhance 160% of image quality given the same radiation dose. This technology has been 510(k) cleared. In a study in Huaxi Hospital in China, over a patient cohort of more than 200 cases, we validated that this technology can provide doctors comparable image quality, but with only half of the radiation dose. So now let's take a look at MR. One of the most powerful AI technologies in our MR scanner is the ACS, which combines the strengths of AI and compressed sensing to achieve super fast scanning and reconstruction time, but still with very sharp images. If we take a closer look at the average acquisition time of different sequences and different anatomies, we can see that on average, we can scan all the body parts within 100 seconds. The head scan can be done in 88 seconds. Cervical spine is within 100 seconds, and so on. So to see is to believe. In order to validate whether our technology can really fulfill the clinical need, we record the videos of an entire working day of an MR scanner equipped with our ACS technologies. During that study, 268 scans were completed in 15 hours, and the scan protocols covered more than 10 body parts. Comparing to conventional PPA acceleration technology, with the same scanning time, we can see a dramatic differences between the image quality of the two approaches. And due to the ultra-fast acquisition time, it helps to minimize respiratory motion and helps improve the image quality as well, and make the anatomical structure clearer to see. So next, let's see a few examples how AI can help clinicians directly. To make AI solutions more reachable to doctors, without any technical limitations and IT troubleshootings. Not only many of the AI functionality are with our scanners, we also provide our AI solutions on a browser server platform, which enables end-to-end optimization of clinical workflow. Our solutions covers various common clinical workflow, including but not limited to chest, neuro, cardiovascular, as well as women and pediatric health management. The application in general can help doctors to triage cases, automatically detect and localize disease, lesions, or anatomical landmarks with automatic quantifications. They also provide doctors longitudinal comparison to monitor disease progression, as well as reference similar cases. In our first example, we show that one advantage of AI is that it can analyze and detect multiple diseases in a single chest CT images. For example, rib fractures, lung nodules, lymph nodes, pneumonia, esophageal cancer, spinal tumor, and bone metastasis, as well as breast lesions. In ER, the presence of multiple rib fractures is an indicator of injury severity in trauma patients, as these findings are highly predictive of poor clinical outcomes, including respiratory failure and overall mortality. It is incorporated into US clinical guidelines to manage disposition of trauma patients. Radiologists often need to spend a lot of effort to make sure they don't miss the reading of rib fractures, and this is where AI can help. Our rib fracture application is deployed in more than 100 hospitals and has seen more than 200,000 patients. It is proven to improve sensitivity and efficiency of radiologists. And this technology got cleared by NMPA, which is the Chinese FDA, and CE, and FDA. In our CTA applications, AI is used to streamline the CTA analysis. In clinic, it takes time for the doctors to manually edit and assess the coronary arteries, and normally it takes more than 30 minutes for one single case. Our AI algorithm can provide accurate and automatic CTA coronary segmentation to 18 or more segment processing, which is compliant with SCCT standard. In addition, our application provides all kinds of rendering for better and easier visualization, both the entire coronary trees or a specific branch, including the MIP, curved MPR, strengthened CPR, etc. In addition, our AI can provide automatic stenosis detection and grading, plaque detection and classification, as well as localization of other landmarks, including stent and myocardial bridge. All this can be processed end-to-end within 20 seconds automatically. Now, let's take a look at our AI solutions to help clinical research through our UI Research Portal, a web-based platform for doctors and clinical researchers to conduct advanced clinical research with AI. So there is a high demand in clinics now to conduct clinical research with AI. The aforementioned UI portal provides streamlined tools for clinical applications. However, they are designed to streamline and improve clinical workflow. In order to optimize clinical workflow, the portal does not provide the flexibility and diverse functionality a researcher would need in clinical research. So in order to support our clinical collaborators, our research portal is designed to provide customizable tools and functionality with flexibility and customizable components to facilitate clinical research. More importantly, it provides many core AI engines as modularized tools that the research can use to pull research data together, to efficiently annotate the data, and even train AI models with our built-in tools. So taking COVID-19 as an example, a collaboration can start with an alignment of research direction and strategy between doctors and AI experts. With the direction and the strategy identified, our research portal provides all kinds of core AI engines and tools for doctors to conduct clinical research to achieve fruitful outcome. So when COVID-19 started, we soon realized that our AI solutions can help our clinical friends and collaborators. Especially, we can leverage our existing AI modules to quickly put together an end-to-end application to help them. So this includes contactless scanning of COVID-19 patients, AI triage, AI quantification, and AI follow-up. So for AI triage, our solution can quickly prioritize positive cases for doctors and the radiologists to pay attention to these cases. According to our clinical collaborator, this successfully brings down confirmation time of suspicious cases to less than 1 minute. It brings significant clinical values to the hospitals, especially when they face COVID surge. After the confirmation, our algorithm provides quantification of infected areas in the lungs and localize these infections in different lobes and segments. Our algorithm achieves 99% quantification accuracy and with very high sensitivity and specificity. In some countries, for example, in China, COVID patient is monitored by CT over the course of the illness. When multiple scans are available, our AI algorithm can align the data automatically and provide longitudinal comparison in each lobe and segment. Physicians can now very easy to understand the development of the infection. Here we can see some visualization on the aligned data of the patient over the course of the illness. So during the surge of COVID-19 in China, our application was deployed in more than 100 hospitals in China. In Wuhan, it was also used in the Huoshenshan Hospital, which is the field hospital built during the time of COVID-19 surge. In that hospital, our study shows that this application had a close to 100% usage on all the COVID-19 patients. So I have shown you three major means how United Imaging AI can help our clinical friends. In the later part of my talk, I would like to tell you a little bit more about how our AI differentiates others. I will tell you about this in three different aspects. First, how we transfer our award-winning algorithm into differentiating clinical products to offer to our customer. Second, how our AI thinking is beyond modality and thus is able to achieve more robust solutions. Third, how our AI research tries to overcome the real-world challenges to enable wider usage of AI in clinical practice for the entire AI field. So we know that one limitation of MRI scan, as we all know, is its inherently long acquisition time. And one common approach to accelerate MRI data acquisition is to take fewer measurements, generate an undersampled case space. However, recovering a good image from heavily undersampled case space is challenging, and this inverse problem is ill-posed. So to solve this problem, we come up with a new AI algorithm called the pyramid convolution recurrent neural network. We try to reconstruct the image from multiple scales. So our model has three convolutional neural network modules to iteratively learn and optimize the images from close to fine priors. At the same time, it keeps data consistency so that it makes sure we don't create additional signals while being able to reconstruct the finer details of the images. So this model won the first MRI challenges in 2019. That's a challenge hosted by NYU and Facebook together. And the final evaluation is judged by radiologists. So from the images we can see here, in this slide, the red box shows example of our AI reconstructed images, while the green box shows the images with fully sampled case space, which means that's without the AI speed up. Okay, So while we have this award-winning algorithms, it doesn't mean that we solve all the clinical problems. For example, when we apply our algorithms to cardiac cine MR reconstruction, we soon notice that although each image looks very good, when we play the images together, there are motion inconsistency. This is because our AI model, when we design and then participate in the challenges, it didn't take into temporal coherence into consideration. So we know that cardiac cine MR is widely used to measure regular cardiac functions, such as ejection fraction, left and right ventricle capacities, etc. However, the conventional retro cine acquisition requires ECG gating and then several breath holds of the patient. This causes a very long acquisition process, patient discomfort, and motion artifacts. It is also a challenging for the technician. To make cardiac MR more widely applicable to more patients and to simplify the scanning process, we extended our award-winning solution to a bidirectional recurrent neural network, which regularized the temporal reconstruction. As a result, we are able to achieve a 12 times speed up in cardiac cine MR acquisition time. So for example, on the top left, we shows how an inverse FFT results from a 12 times undersample case-based data looks like. And from that kind of data, our AI is able to result from our solution on the right. So our method is able to restore the data with good spatial, but also temporal resolution with high signal to noise ratio.